Yes, good morning. It's certainly a pleasure of mine to be here once again. And I would like to extend special greetings to the staff of the Community Counseling and Assessment Center all the way there on North Collins Avenue under the leadership of Dr. Sonali Ferguson Parker and Sister Julianne Nen.
Wow, you got such a powerful, powerful crew right there.
Yes,
Okay.
they do a yeoman service in helping persons in the community who are suffering with mental health disorders.
Wow. Wow. So I know you've got a lot to say, but we're going to dive
Yes.
right into it. Let's start off with the basics. What exactly is anxiety?
Yes, anxiety is something that all of us will experience through the course of our lives. And it is an inbuilt system that is protective. And all of us would experience normal anxiety.
Mm-hmm.
But there is a subset of the population who would experience signs and symptoms of anxiety disorders. And so once you are evaluated and diagnosed with an anxiety disorder, you will be experiencing emotionally distressing symptoms such as anxiety symptoms, which include sensation of your heart racing, the sensation of butterflies or a hollow feeling in the pit of the stomach. There also could be pins and needles sensation, and this usually occurs when you would have experienced panic, or maybe your life was threatened with fatality. And certainly if you heard a loud explosion, this can evoke anxiety. Now, there's some persons who are unable to turn off the adrenaline valve because this whole system is under hormonal control.
Mm-hmm.
And these are the people who will go on to develop anxiety disorder. And they will have a loss of functioning in their social, occupational, religious, family functioning of lives. And these are the persons who may access the emergency room department,
Mm-hmm.
and also with their primary medical physicians. So not all anxiety is abnormal.
Mm-hmm.
The type of anxiety when a dog runs after you, there's a normal response. If you're walking in your community and a dog runs after you, a pit bull or a Doberman Pinscher is going to evoke what is called the fight or flight response. And that is a normal response when you perceive a threat in your environment. But the disorder is when persons are having an exaggerated response,
Mm-hmm.
and they require physician care, and that could include a medical physician and also a psychologist and or psychiatrist.
Okay, let me ask you this. I'm going to put myself into it because I feel as though the things that you have said was anxiety. I think I went through that as well, but for me, it was because of relationships.
Yes.
Would that be considered anxiety as well?
Yes, there are different forms of anxiety disorder, and examples I would like to give. There's what is called panic disorder,
Mm-hmm.
where persons are experiencing panic attacks,
Mm-hmm.
and these are short period of what I mentioned already, the symptoms of panic, which could be the sensation of your heart racing.
Mm-hmm.
And there are persons who have these panic attacks ongoing and may require medical evaluation in the emergency room and also referral to see a psychologist. We also have conditions such as generalized anxiety disorder, and there's a subsection of persons who receive treatment at the Sandilands Rehabilitation Center and also at CCAC,
Mm-hmm.
and also with their primary care medical physicians who have an ongoing progressive worrying about the future, and also they may be going under experiencing stresses such as financial stress,
Mm-hmm.
relationship stress, or
Mhm.
even marital discord that can be an ongoing stressor. And these persons may experience muscle tension. They may also experience panic attacks, these periods of heightened anxiety symptoms,
Mm-hmm.
and they may experience muscle tension. So there's a combination of physical and psychological symptoms with the generalized anxiety disorder.
Okay.
There are persons who also may experience social anxiety disorder, where they have a fear of the performance situation.
Like stage fright.
Yes. So
Okay,
there's some
okay.
persons who, when they call upon to speak in front of a group, or maybe do a presentation at a lecture hall, they just the very mere thought of doing that
Mhm.
presentation can evoke panic, anxiety symptoms.
Mm-hmm.
So much so that the persons may refuse to do it, and they do not offer themselves, especially if they're in college or university, to participate in group activity or lecture presentation. And
Okay.
so we also have specific phobias. There are persons who have phobias of spiders, they have of lizards, they also have phobias of the lightning and thunder,
Mm-hmm.
And also, there are persons who are afraid of blood, and they have certain specific phobias. There are also phobias related to situations where persons may have a fear of going outdoors, and this is known as agoraphobia, and they feel as if they will face embarrassment, and they have a belief that there's no way of escape if they go to the mall or they go outside to one of our parks. They
Mm-hmm.
will have this heightened anxiety. That's agoraphobia. And there are also other type of stress disorders with anxiety, known as adjustment disorder.
Mm-hmm.
And this occurs in individuals who are under a lot of stress, maybe the loss of a job, the end of a romantic relationship, or ongoing feud with family.
Mm-hmm.
And this can evoke anxiety in these individuals, so much so that they have a pervasive fear of doing things. It cripples their work
Mm-hmm.
drive, their ability to go out and socialize and
Mm-hmm.
have meaningful relationships.
So what you're saying basically is anxiety is a natural thing. Everybody
Yes.
experiences anxiety, maybe even every day. But tell me, when does anxiety become a disorder, and how do we define an anxiety disorder?
Yes. So in states, as I told you about, this system that we have inside of our bodies, we're so wonderfully built. We
Mm-hmm.
have a system that is under hormonal control, and some of I'm sure you've heard about the hypothalamus, the pituitary gland, the adrenal gland, and these
Plenty
are,
big words.
yes, the
Small it
HPA,
down for us.
yeah, the HPA axis, and you could go online and read up about this axis. But there are organs in the body, endocrine organs that control the fight, what is called the fight or flight response. And I'm
Mm-hmm.
sure most of you, if you did human biology in high school, you would have learned about the fight or flight response. But
Mm-hmm.
this is the inbuilt protective system that helps us to, if a dog runs after you, the system will be engaged.
Time to run.
Yeah,
Okay.
either to take flight or to fight what you perceive as a threat in your environment.
Okay.
Now, the system is under hormonal control by way of adrenaline.
Mm-hmm.
Adrenaline is a stimulatory hormone that is released from the adrenal glands.
Mm-hmm.
And this is under direct control of the hypothalamus. These are glands in the brain that release certain factors to stimulate the adrenal gland to produce the adrenaline and also cortisol.
Wow.
These are stimulation or stimulatory hormone that gets the body ready to either fight what it perceives as a threat in the environment or take flight
Mm-hmm.
to run away.
Mm-hmm.
Now, when we evaluate persons, if we see there is a preponderance of these emotional distressing symptoms, which I mentioned,
Mm-hmm.
the panic symptoms or anxiety symptoms, and the person can really manage those symptoms. They have a loss of functioning. They may be unable to go to work. They may be unable to drive. The fear of, and especially with specific phobias, they have a fear of spiders and lizards, that so much so that they may be unwilling to go outside. This really can cause a diminishing of their functioning in life arenas.
Mm-hmm.
So once we see the presence of emotionally distressing symptoms, we see the loss of functioning in that individual, then it's time that that person requires a medical evaluation, because we have to rule out if there are any medical cause for the symptoms, such as thyroid gland disorders. There may be some abnormalities as it relates to the medical state of the individual. And once they are cleared medically, then they can be referred to see a psychologist
Mm-hmm.
and or psychiatrist for talk therapy to help them. And talk therapy involves cognitive behavioral therapy, something to help them deal with the negative thoughts that they're encountering on a daily basis, the ongoing stresses, and how to manage any the sense of loss and grief in their lives. Also, medications are useful for persons who experience anxiety disorders. And we have anti-anxiety medications such as, I'm sure you've heard about Xanax and Ativan, but these are used short term. But the controller of any ongoing anxiety, the symptoms include what they call a selective serotonin reuptake inhibitor. That's your Prozac, Paxil, Effexor, or venlafaxine. These are the controller medication to control a lot of the symptoms.
Wow.
Now, there's no cure-all for anxiety disorders. And I just want to let the public know, because I oftentimes persons are ambivalent about taking medications. But we, as a psychiatrist, we look at the whole person. So we address the psychological issues that the person is experiencing in terms of the ongoing stresses or trauma. Trauma from the past can also cause panic symptoms, panic disorder. If your life was threatened with fatality, or you nearly died in a motor vehicle accident or drowned, this can evoke these panic disorder and also specific phobias.
Wow.
So we rely on our talk therapist and also the medication management and ongoing follow-up with the individual.
Okay. Now, of course, once again, we are in with Dr. Kirk Christie. If you have any questions for him, of course, you can give him a call, 326-0272, 326-0271. So we're going to jump off of anxiety for a minute, and we're going to go down into understanding depression, and that
Yes.
also is part of suicide.
Yes.
So depression is a term we often hear, but what is it really? What are some of the symptoms that we can experience with depression?
Yes, this is a very important topic because now in our society we see completed suicides. We also see failed suicide attempts. And we also see persons walking around with a lot of suicidal thoughts. Completed suicide tells us very little because in the background we have persons who may have failed completing the completion of suicide, and there are also a lot of people who are harboring suicidal thoughts and ideas. Now, we would like to encourage persons who are having persistent sadness, and usually the major criteria to make the diagnosis of major depression or clinical depression is persistent sadness throughout the day for days back to back. And usually, if these symptoms persist for 2 weeks, that is a definite sign that the individual may be depressed, in addition to other symptoms, which may include a loss of interest in engaging in once normally enjoyed activities, such as whatever you like to do, watching TV or backyard farming or exercising, if you have lost the interest, and also the enjoyment. If you participate in those activities, but the enjoyment is no longer there, this is a major symptom of depression. The other minor symptoms of depression include either oversleeping or insomnia, the sleep disturbance. You have difficulty falling off to sleep, or you can fall off to sleep and you wake up in the early morning between the hours of 2 a.m. to 5 a.m. and you're unable to get back to sleep. And there are persons who may have a foreshortened sleep. They get off to sleep at about 11 p.m. or 12 a.m. They sleep for about 3 hours, and they up for the end of the sleep. They're unable to get back. And also weight gain or weight loss, certainly harboring guilty ideas or guilty thoughts. These are the minor symptoms of depression. Also having suicidal ideas and or even having a plan to complete suicide. These are symptoms of underlying depression and should not be ignored. Oftentimes, we often tell persons we are dismissive. Many of us are dismissive of our loved one who comes and say, I'm feeling suicidal, I'm having these unusual, abnormal thoughts. Or they may all of a sudden, a gregarious, very social person begins to withdraw from activities that they once enjoyed. They were very sociable. They were involved in church. They were involved in social outings with the family, and they withdraw from these activities. This is a positive red flag sign that persons should not be dismissive. And certainly, I would advise that you talk with your loved one and really don't dismiss what they're telling you, and listen with sympathy, and also go with them to see a professional, whether it be their primary medical doctor. And usually depression is treated in the primary care setting. And so I would admonish loved ones to go with their relative to their primary care doctor. Now, there are some barriers to treatment. There are a lot of people who are fearful of going and saying, I'm feeling depressed. And so it is very difficult if you are depressed, and even going to see your doctor may be a difficult task. And so this is where family support or the support of a friend or a trusted confidant is very important. Now, there could be something called smiling depression. There are many people who appear to have it all together. And so when they go, they're still sociable, they're smiling with everybody, but the family is noticing subtle changes in their attitude, their behavior at home. And so there are individuals who put on a facade that they have it all together, but they may be experiencing major depression symptoms. And so I would say, again, talk with that person, provide a listening ear, and do not pass judgment.
Now, I know you might have gone through a few things that how depression would be treated, but tell us. I know you said I don't remember how you put it with your big words, but how is depression typically treated, and what options are available for people here in the Bahamas? And I don't know if you know, but there are certain things that we feel as though Bahamians don't experience. So depression is, in my opinion, is one of those things. You might be depressed. You might have a family member depressed. You yourself might be depressed, and you're in denial of it. So how is that treated, and how do you get them to come in and do something about it?
Yes, very good question. And what I would say is that we offer holistic treatment as psychiatrists. 30, 40, 50 years ago, there was just a reliance on medications and certainly, you know, for persons who were suicidal, they were sent to the hospital and maybe sent there for 2 to 4 weeks for an inpatient stay. But we have evolved in terms of the management. And what I can say to you is that we follow evidence-based medicine, which means that we are on a monthly basis updating ourselves on the management of the common mental health disorders. And so there is a reliance. Once a person is referred to see a psychiatrist, the focus is on talk therapy to help the person deal with any issues that they may be having in terms of grief, loss, and some of the risk factors include past childhood trauma, also past childhood abandonment and neglect by way of the legal guardian or their parents. And so we address some of those issues from the past, and it's ongoing. Talk therapy will be ongoing for a person who is depressed. There's no quick fix that a psychiatrist can just wave a magical wand. But medication management is useful in the more moderate to severe symptoms of depression, especially when in instances where the person may be experiencing suicidal ideas, they may be committed to attempting suicide, and there's a definite suicidal plan that they have. Those persons will have to be admitted at the Sandilands Rehabilitation Center. And we have a wonderful team of professionals at the Pulaski ward, which is our acute care ward for the females. And then we also have for males, the New Eloise Penn ward, and we have professionals there. We have psychologists, we have recreational therapists, occupational therapists. So we also have social workers who are advocates for our patient, and they provide a lot of care from the time of admission to discharge of our patients. So it is called a holistic treatment approach that is patient focused. And it also continues on the outpatient basis. We follow a collaborative care model where the patient is the focus of our attention. And certainly since I've been in psychiatry, I can say we have a cadre of very professional male and female psychiatrists, and they're doing a yeoman service in the community and helping our people. We also have family island visitation to major islands, and we hope to expand our coverage of psychiatric mental health clinics in the family islands in the near future.
That's wonderful work you're doing, and that's wonderful the information that you've given us so far. So far, we've covered, we touched anxiety as well as this bipolar disorder. We're going to be jumping back in just a moment. We're going to take a short 5 to stay alive. Those of you that may have questions of your own, this should be touching all of us. I'm pretty sure we all have somebody, if not ourselves, that have been going through this. I know for Bahamians, we tend to feel as though what the rest of the world might be going through, we don't go through, especially mentally. It's like we don't do therapy, we don't do this, we don't do that, but it is something that is necessary and needed in our communities. Once again, our call-in numbers, just in case you got questions of your own, 326-0272, 326-0271. We're going to play one song and we'll be right back, so don't change that dial. This is Global 99.5 FM.
Celebrating our brilliant Bahamian women. Mrs. Rosamond King, stands as a distinguished leader in executive management with a remarkable career spanning both domestic and international arenas in strategic management and global alliances. Her journey exemplifies determination, innovation, and barrier breaking achievements, aligning with the spirit of International Women's Day. A passionate advocate for lifelong learning, Mrs. Carey holds a Master of Business Administration from the University of Cumbria, England, and is currently pursuing a doctorate in business administration at the same institute. In a historic milestone, Mrs. Carey became the first female president of the Bahamas Association
Okay, it's a pleasure of mine to be here, and certainly these are very important topics that persons in the community need to be aware of and know the signs and symptoms of these disorders.
Now, we've already covered or we've already touched anxiety and depression, and we're now down to understanding bipolar disorder. What is that?
All right, very important. Bipolar disorder is a name for a set of conditions where there are mood disturbances, and primarily the mood disturbances that may be seen are called mania, which is the high pole symptoms, and this includes persons who may display elevated or irritable mood associated with sleep disturbance, where they may have difficulty falling off to sleep. They also may be engaged in reckless spending and impulsive behavior in terms of doing things that they would not normally do when they were not in the manic phase. And they may also experience emotionally distressing symptoms where they would lose all of their savings. They may be engaged in promiscuity when they are in the manic phase of the illness. They may just give away all of their money and their assets when they're in the state of mania. Now, alternately, they may also be in a state of depression. And so persons with bipolar disorder can also present in a state of depression, which we mentioned earlier. And the classic signs of depression include persistent sadness throughout the day for days back to back, the loss of interest and loss of enjoyment in once normally enjoyed activities. And the minor symptoms of depression include sleep disturbances, weight gain or weight loss, also irritability or slowing down of your activity level, so much so that you may feel lethargic and you may have lack of energy. You may have a preoccupation with guilty thoughts, feeling guilty about things that you did in the recent past or the distant past in your life. You may also have suicidal ideas and also a suicidal plan. In the state of mania, persons can do things that can jeopardize their life. They may be driving and they are elevated in their mood. They may be engaged in reckless spending, which could put them in jeopardy. They can spend their mortgage funds or any other savings that was earmarked for other things. And so bipolar disorder is a very important disorder that if you recognize that your loved one is having these period of high and low, they should be seen by their primary medical doctor to undergo a medical evaluation. Once the medical evaluation rules out what is called an organic or medical cause, because sometimes there could be some hormonal disturbances that can cause mood changes, especially in females. And so it's advised that you see your primary medical doctor. Once they recognize that it's not a medical cause, they will refer you to see a psychiatrist for further evaluation. Now, it's often a misdiagnosis because sometimes persons present with depression symptoms. And if the physician or the nurse who does the intake doesn't inquire about the high pole or the manic symptoms, it could be a misdiagnosis. And so those persons may be undertreated. They may be put on an antidepressant, or they may also be referred for talk therapy, but the psychiatrist may be unaware that there were manic episodes in the past. So it's very critical that you ask all of the relevant questions about mania. And we do this whenever anyone presents with a mood disturbances. We ask about manic symptoms and also depression symptoms.
Wow.
The risk of suicide is very high in persons with bipolar disorder, especially in the states of mania and also depression, because you're already experiencing suicidal ideas and you may have be committed to completing suicide and also have a definite suicide plan. So one should not be dismissive of anyone who comes to you and tell you that they're feeling really, really depressed, or they may be experiencing these high pole symptoms. Listen to them. Do not be dismissive and accompany them to see their primary medical doctor.
Don't laugh either, right? Sometimes if you have somebody saying that I feel depressed, especially for Bahamians, I find that Bahamians, once again, tend to feel as though they are immune to certain things.
Yes.
Depression is one of those things, in my opinion. So if someone comes and said, man, I ain't feeling too good, I'm feeling depressed, and it's been like that for a minute, as he said, if it's been like that for, like you said, at least 2 weeks even sometimes, or just a few days, take them seriously. Now, I remember in the past, especially for high school, when when it came to mental health, we would have found that the adults would have turned to alcohol. Alcohol was one of the
Yes.
things. So well, let's address addiction and seeking help or substance abuses when it comes
Yes.
down to mental health.
Yes. Very good question that you have. And oftentimes we see persons who are experiencing moderate to severe depression symptoms and also even manic symptoms.
Mhm.
They turn to alcohol to escape those current emotionally distressing symptoms.
Mhm.
So alcohol becomes a replacement substance for them to escape their current reality. And
Temporarily.
so much so, yes. And even chronic persons can go on, they can use it temporarily, and which is called problem alcohol use, and they can move on to developing an alcohol addiction. And so oftentimes we see in about 50 to 60% of our patients who are admitted to Sandilands, when we inquire about substance misuse, we find that most of those persons, on average, about 50 to 60% of those admitted, they
Mhm.
also have a co-occurring substance use disorder. Now, we moved away from terming it addiction because they're a pejorative term. It's a pejorative term, very stigmatizing. So
Mhm.
the correct term now is substance use disorder. And so persons who are misusing alcohol, we would diagnose them with an alcohol use disorder.
Mhm.
If they have a cocaine use disorder, we would diagnose cocaine use disorder, and similarly marijuana use disorder.
Mhm.
So Sandilands has moved away from using these pejorative terms by way of evidence. We found that treating people fairly, we've introduced a human rights approach
Mhm.
to the way we manage patients at the Sandilands Rehabilitation Center.
Mhm.
Also in private practice, we treat people fairly. There is certainly strict confidentiality and anonymity when you enter a psychiatrist's office.
Mhm.
And so there's still stigma that abounds in our community. There are a lot of people who are fearful when it comes to seeing a mental health professional.
Yes.
And what I would like to do is dispel this myth. You don't have to suffer in silence. If you need help, come to us. There are several psychiatrists practicing in private practice. We have our community counseling and assessment center, and you can call 323-3293 or 323-3295, and you can make an appointment to see one of the psychiatrists at the
Okay.
Community Counseling and Assessment Center on North Collins Avenue and the corner of Collins House.
Okay. I have one more question for you. All of this sounds great. Getting help is great. The fact that help is there is great. But is there a charge? And if there's not a charge, is there a way for those that have financial support, if they can
Yes.
give any type of donations to your cause?
Yes. Well, I would just like to say I see a future where all people who have mental disorders and emotional difficulties can feel empowered to seek and receive the highest quality of mental health care that is available to them. Additionally, that we all better understand the importance of mental health to our overall health and development as a nation. And we have professionals at the Community Counseling and Assessment Center. There's nothing to be afraid of. There's a registration fee that persons would have to pay. There's also psychiatrists available in private practice. There are fees if you see a psychiatrist in private practice.
Mhm.
But certainly I would say to families, certainly do not be dismissive of your loved one's symptoms, especially if you're seeing these emotionally distressing symptoms that we mentioned earlier.
Mhm.
And if there's a definite loss of functioning of that individual in their social, family, educational, religious arena of life, go with them
Mhm.
and sponsor them a visit.
Mhm.
And the fees are not beyond payment in private practice.
Okay.
We charge patients fairly. We do accept insurance in private practice. Of course, there's more time given when you see a psychiatrist in private practice, at minimum 1 hour,
Mhm.
especially for the initial diagnostic evaluations.
Okay.
But we have our community counseling and assessment center there. We also have our physicians if you're on the Family Island. And I would just also like to give a greeting to Dr. Hilaire at the Nicholstown Community Clinic and Dr. Carey. They're doing a yeoman service on the island. And you could see physicians, your primary care physicians on the family of violence,
Mhm.
and they will do the evaluations. We also consult with those physicians. So we have about 10 psychiatrists. We consult with the Family Island physicians. And so they would call us for assistance when there are complexities in treatment. But do not suffer in silence.
Yes.
Go and get the help that you require.
All right. Well, thank you, Dr. Christie, for sharing such valuable insights with us today. Mental health is definitely a critical issue, and it's important that we continue on having these conversations to break the stigma. And while I'm saying that, I'm going to tell you one more time, don't be a stranger. You got to come back in, okay?
Yes, I
All right.
certainly
You got to
will
give me
be
daps.
back.
I know you pretty proper.
Yes, yes.
We got to, let's make sure we don't be strangers, okay? Ensure that everyone knows help is available. So if you or someone you know is struggling, please reach out to the sources or the resources mentioned today, and make sure you stay tuned to Global 99.5 FM. We got more coming your way. Anything else you want to say before we close up?
I would just like to encourage everyone in the communities. I know it's a very difficult time for many persons. The misery index is up, a lot of financial constraints on families, but continue to be hopeful and continue to talk with your family and talk with your loved ones and extended family.
Yes. It's been a pleasure, Dr. Christie. Thank you so much for joining me right here on Global 99.5 FM. We're going to jump right back into the music that you love, but don't forget, we got more interviews coming your way, and you don't want to miss it.